Hi, I'm Neil Eaves. I'm a professor in the School of Health and Exercise Sciences, and I teach Human Kinetics 410, which is a respiratory physiology class called Respiratory Disease Pathology to Prescription. Well, at the time, it was that I needed a job, to be completely honest. But what drew me to the school and what excited me about the school as I arrived here was it was a relatively new department with some very good people here. And they had a focus in the undergraduate curriculum. One of the focus was on clinical exercise physiology, which is a real passion of mine. And I felt this was something or I could contribute to and really try and make UBC Okanagan a well-known institution in that field. So my main interest, I'm a clinical exercise physiologist with training in respiratory and cardiovascular physiology. And I'm interested in how disease states, especially respiratory and cardiovascular disease states, alter the physiology, and then how we can use novel and innovative therapeutic interventions like exercise to actually modify disease and help people who have these conditions. My research program really has 3 or 4 main foci. What we're trying to look at, first of all, is understand the mechanisms of poor symptoms that these individuals have, especially shortness of breath, which is known as dyspnea, and muscular fatigue, which I collaborate with Chris McNeil within our school on, and also looking at how those symptoms affect exercise tolerance and the ability to move within our own environment. I'm then interested in the cardiovascular consequences of respiratory disease and how diseases such as COPD influence the heart, the lungs, and the vasculature, and how all 3 of those systems interact together to form the symptoms that cause the dyspnea and the leg fatigue. And as I mentioned in one of my previous answers, I'm really interested in how we can then modify these disease problems and actually utilize things like exercise to try and overcome these physiological problems and help these people live happier and more beneficial lives. Well, I think there's a lot of opportunities. You can pretty much design your own opportunities in some of the labs around the Okanagan, which I think is very, very unique and interesting ways of doing things. But through scholarship programs, through the 499 courses or through the honours program, you can formally come and work in the lab, or you can volunteer. We're always looking for volunteers to work on research programs or research projects. And through these, you can come in and get involved in a whole variety of different research, either with healthy young people looking at some of the mechanistic aspects of respiratory and cardiovascular physiology, or if you're more interested in the clinical populations, working with people who have disabilities and major limitations caused by their disease, but look at clinical exercise testing, clinical pulmonary function testing and cardiovascular testing, but also then aspects of rehabilitation and how we can actually improve these people's functional capacity by working with them in interventions like exercise training. One thing I've learned later on in life, which I probably should have known earlier on, is that physiology is so integrative, and it's important not to just understand how the lungs work or the heart works or the brain works or the kidney works, but to try and, as you understand these systems, put the pieces together of the puzzle so that you can understand how they all affect each other. And that's when you can start getting really innovative ideas and really start understanding how the human body works. Well, I've had a number of interesting jobs. Probably the most interesting was as a young adult, I was a suit advisor. So I sold suits to people. I fitted them and advised people on what suits made them look best for professional situations.